Hello, welcome to Convict Inc. I'm your host, Robert Rosso. Before I get started on today's content, there's two things I want to bring up. First, today is December the 13th. That means that I've been out of prison exactly 8 months today. Let me fix this. Okay, is that better? I don't know. Okay, that means I've been out of prison exactly 8 months today. The reason I bring that up is because it has been brought to my attention by more than several people that there's a few things that I've said in some of my videos that could be offensive in today's world. I was in prison for a long time, you guys, 23 years, 8 months, 1 day. And prison's a whole different world. So what's going on out here in society, we're progressing at a rapid pace. And what was normal or what was said back when I was a kid could be really offensive today, and vice versa, actually. So, and also when it comes to race, prison is like one of the most racist places in the world. I mean, you're segregated because of the color of your skin by staff in the Bureau of Prisons. Not all prisons, but in most. So it's a really different world for those of you that haven't been there. So I don't mean to offend. I'm working on trying to figure out society's norms nowadays. If I offended anybody in any way on certain things that I've said, I do apologize. Again, 8 months. It's kind of been like a long time, but then 8 months is not a long time. So I got mixed feelings about if 8 months is a long time out of prison. Sometimes I really feel like I've never been in. Okay. Anyway, so. I get it. There's some things I'm not going to go back and delete or change any videos. I'm just not going to do it. But if you were offended by anything I said in the video, then I do apologize. Again, I'm trying to navigate this new world of ours. Okay. Second, some of you guys that subscribe to this channel might realize that I didn't put very many videos out last week. It was 2. Well, I had surgery. I have recurring bladder cancer, and I had a reoccurrence. I had one small tumor. It's actually my 23rd reoccurrence. A little painful, but otherwise I'm okay. So yeah, I'm great. Everything's good. It's kind of normal to me now. But that leads me into today's show. So what we're going to talk about today, what I'm going to talk about today is being diagnosed with bladder cancer in prison. I was going to do like an overall healthcare and Bureau of Prisons. That's just too vague. Let me keep it personal for a minute. I might do a couple parts. Let's see where I go. Yeah, this is a story for some. So anyway, okay. I entered the federal prison system in September of 1998. Actually, I was arrested in 1997, but I never got out. And then I was sentenced to life without parole. And then I entered the federal prison system, the Bureau of Prisons, Federal Bureau of Prisons, in September of 1998. Stayed at Leavenworth was my first prison. I stayed there until October of 2002. And then I was transferred to USP Lewisburg in Lewisburg, Pennsylvania. At Lewisburg, I was there for about a year, and I started noticing that I was having some health problems. First of all, I started feeling tired and sluggish, and some blood work revealed that I had hepatitis C. So I contracted hepatitis C, and I contracted hepatitis C from being a dope fiend. Never used a needle on the street, went to prison. Began using heroin the first day that I entered Leavenworth, and became a professional at it. Let's put it that way. When you use drugs intravenously in prison, most start off, you bleach the needle every day 4 or 5 times, and then it gets to be a chore because you're in a hurry, so you just start rinsing out the needle. I know when I contracted the hep C, I know who I contracted it from. I know the shot that I got it from. I got sick following the shot that I did it from. So I contracted hep C, and it was a big blow to me psychological, because I had always prided myself on being a clean dope fiend. Well, On the heels of that, I started experiencing blood in my urine. So at first it wasn't red. It was an orangish tint. It was off, but there was blood. I knew instinctively that it was blood without being told. This is the beginning of 2004. So January 2004. I went to medical, and in the prison system, Federal Bureau of Prisons, if you have an issue, you go to sick call. Sick call back then, I think, was on Monday, Tuesdays, Thursdays, and Fridays. Wednesday was a hospital review. And you go in, you fill out a sick call slip, ask what's wrong, give it to the PA or a nurse on duty. Usually it's a PA. And then they'll call you in later or tell you to sit and wait depending on your circumstance. In my case, I put blood and urine, and they said, okay, we'll see you when we see you. And it was some days before they'd call me back down there. And sure enough, when I took a urine test, culture, I believe it was, I was positive for blood. And they're like, yeah, you have blood. And I'm like, okay. So we'll get the PA. So we'll get you fixed up. We'll talk to the doctor. So some time went by, and I didn't see a doctor. So I went back down there again. They had me pee in a bottle. Again, there was this time more blood. There was also some other issues with my urine. And the PA went and spoke to a doctor. I did not see a doctor. Came back and they said, go to the pharmacy, go to Pill Line later, and you'll have a prescription. I don't recall what the prescription was at this time, but they gave me a prescription. I started taking it, and it didn't work. Went back down there. Sick call, a couple days, couple weeks later. Actually, it was about a week later. More blood. So I've told the PA I'm still having these issues. They prescribed me a different narcotic prescription. I'm sorry, it wasn't non-narcotic, different medication. He tells me not to come back until I finish the script. I come back and I have blood in my urine, and the PA said, stop having sex with men. That's what he said. That's why he said that I was having blood in my urine. He said that he was alluding to the fact that I was having urinary tract infections that were causing me to bleed. And that's the reason that I was peeing blood. And I was pissed. No offense. Here we go again. So no offense to anybody in the LGBTQ community. In prison, that's a big deal. Being said something like that, or being told something like, especially by staff. I mean, people have, assaulted people over that. So, yeah, I was offended. Okay, I was definitely offended, and I could not believe that was this man's response to me. And so I started filing using the administrative remedy process. The administrative remedy process is grievance forms. You start off what's called the BP-8, which goes to your counselor. The counselor either resolves it or he doesn't. If he doesn't give a response that you find appropriate, you can file a BP-9, which then goes to the warden. If you don't like the warden's response, it goes to BP-10, which is a region, and then a BP-11, which is to central office. I filed the BP-10. Hospital administrator comes to my cell and says, what's the problem? And I said, the problem is that I'm pissing blood, and your PA said that I was a homosexual. That's the problem. And the hospital administrator actually laughed about that. So anyway, I ended up seeing a doctor, Dr. Busanich, who referred me to a contract urologist. A lot of the specialists are contracted in the BOP. They come in once a week, once a month, or you go outside, or they bring you outside to see them. In this case, there was a contract urologist. It was a father and son team. Their name was Chopra, Doctors Chopra. And the old man was late 70s, early 80s, and the son was in his 40s. I first saw the father, who came in, and the first day I walk in and he said, okay, take your pants off. Yeah, pants off. And I'm like, what the fuck? What do you mean? He's like, bend over, we're going to check your prostate. And he's like putting the gloves on, and I'm sitting there looking, and I'm like, okay, there's a female nurse in there. I'm not really shy, but to have a man do a finger wave in me, it was kind of a little bit humiliating. But what am I supposed to do? So these are medical professionals. That's what I did. So he, I was in what's the emergency room of the hospital, and I went ahead and took my pants off, and I bent over, and I don't know if he had fingers like this long. That's what they felt like. And he goes on, and I guess does something what refers to milking my prostate. And for those of you that don't know what that is, they actually push on your prostate until fluid comes out, and it was horrible, a freaking horrible experience. And he says, as he's, got his freaking long fingers in me and pushing hard, that, oh yeah, you got chronic prostatitis, or, it's from India. That was Pakistan/Indian accent. Sorry, that's what it was. That's where he was from. And I actually like Dr. Chopra, but that's how he sounded. And so they diagnosed me with chronic prostatitis, gave me some more pills. Problem didn't go away. Over the months that followed, I started urinating blood, the color and texture of V8 juice or tomato juice. Then it got worse than that. From the tomato juice, little black chips started coming out of me. And then the little black chips got bigger. Now, what was happening is that I did have bladder cancer. There were multiple tumors in my bladder, and the tumors would break. It was the clotting. There were blood clots. They'd bleed, they'd clot, and then the scabs would come out, and they would be black. So, and sometimes they got so big, about big as my fingernail, and they would come down my urethra, and the stream of urine would stop. So I'd be urinating, and all of a sudden they'd go like a snake coming out your prick, boom, and it would shoot into the toilet. So then you'd get this bam, and it was black, blue, and it had blood around it. It looked like it was breathing, and it was just gnarly. Mentally, it had me so shook in the head. I continued filing my administrative remedies saying, help me, this is what's going on. And then I got wise, and I had my family order me a medical book. The book was the CMDT, Current Medical Diagnosis and Treatment book, which the prison doctors were using at the time. This is before computers, guys. We're everywhere. And I had a medical encyclopedia. And in less than 3 or 4 hours, I knew I had bladder cancer. I literally diagnosed myself. As a matter of fact, and I keep saying I got to start doing this. I have all the administrative remedies that I wrote. I've got them in this closet that's right beyond where I'm talking. And I can read you verbatim everything that I wrote. And I wrote in the administrative remedy, I have symptoms consistent with bladder cancer. So from the time I started experiencing blood to the time they finally got me to the hospital, it was 9 months. So, and this is how it happened. What was going on is if you have blood in your urine and they suspect something, they're supposed to do a cystoscopy. A cystoscopy is like a colonoscopy, only the other end. They stick a tube up your urethra, looks inside your bladder, comes out. That would be able to tell if there's tumors in the bladder. There's other ways you can ultrasound it. They didn't do an ultrasound. I don't remember why. They were supposed to, something happened. Buried in the doctor's notes was a request for a cystoscopy that got lost, that was overlooked. And that happened like in the 3rd or 4th month. So somebody, I think it was Dr. Busanich, put the right notes out there. He needs a cystoscopy to see if he has bladder cancer. They didn't say that. It said needed cystoscopy. Actually, it was Dr. Chopra when he came in when he diagnosed me with chronic prostatitis. He did a referral for a cystoscopy, and it was missed. There was a regional director who was the warden of Leavenworth. The man's name was Mickey Ray. Mickey Ray was a famous warden/regional director in the Bureau of Prisons. I had a history with Mickey Ray, and the history with Mickey Ray was because I assaulted somebody in his chow hall, and I didn't know he was the warden the day that the assault happened. And when he was questioning me, I had blood on me, and I was really rude, and I talked real bad to him. And then I found out he was the warden after, I said, who the F are you, or something like that. But anyway, over 2 or 3 years, I had a history with Mickey Ray. I was somebody he considered one of the trouble inmates, or assholes. Okay, so he was instrumental in having me shipped from Leavenworth to Lewisburg. So he was a warden at Leavenworth and then got the job as the Northeastern Regional Director, which covered USP Lewisburg. So he brought me and some crew of my brothers with him when he moved up the ladder in the BOP. Well, Mickey Ray, just in spite of what he was a fair guy. If he told you something, it was going to happen. So if he told you to F off, that's what was going down. If he told you that he was going to do this for, he did. So I had respect for him. And even though I was how I was, I do believe he respected me too. Region, it's called Region. That is the regional director and other people from the region come and do a tour of the prisons periodically. Let's just say every 3 months. I think it's every 6 months. I found out that Mickey Ray was coming as I was having these problems with my urine. On the morning that Mickey Ray came, I peed in a honey bear bottle. Like the little bear with the honey on it. I peed and I filled it up. And on top of it was little blood clots, the little blue blood clots that were floating. And I went to the chow hall. And when I walked in the chow hall, I walked up to him and I said, "Hey, Mickey Ray." And he said something. He used to call me out. He'd cuss at me like a sailor. "Hey, what the F you doing, you sorry asshole?" That's how he talked. And I said, "I've got a problem and I need your help." And I whipped it out and I thought they were going to drop me. I thought the staff was going to tackle me. Like I was going to take this and throw it on him. But I told him, "This is my urine. This is what's going on." And that man looked right at the warden and said, "Get this son of a bitch to a hospital right now." I explained my story first. I'm sorry. And then he said, "Get this son of a bitch to hospital." He didn't say, is he lying? He didn't check up. He knew I was telling the truth. September 4th, 2004, in the wee morning hours, I was transported from Lewisburg to, forgot the city. Oh, I'm sorry. This is bad. I'm a bad host for this. About a 45-minute drive. I was driven in a prison van, and in the van there was the lieutenant, the driver, and a gunner in the back. The gunner right behind me is holding a shotgun. In the car in back of him is the chase car. There's a staff member back there following the van, and in front of him was the lead vehicle. I was on a 5-man hold. I had life without the possibility of release. I was a nonviolent drug offender, but it took 5 staff members to transfer me anywhere I want. If I had to leave that institution, there was 5 staff members coming with me. When we get to the hospital, I want to say Union, but it's not. Union was the one in Terre Haute. It was dawn. It was still dark out, starting to get light. The van pulled up to the front of the building. And again, we've got the chase car and the front car. So everybody pulls out. Hospital cars come make a circle around. I didn't know the hospital had such a big police presence, or, the hospital police or whatever they are. So, 3 or 4 vehicles pop up. So I got the van I'm in and the chase car and the back car. And then a county sheriff was there for whatever reason. I think he was just there. But all these law enforcement descend upon the front of the building to move me. Boom. Everybody gets out. They slide open the van door and they take me and they put me into a wheelchair. And when they put me in a wheelchair, they then handcuff me into the wheelchair. Now, I've got leg restraints. I've got the belly chain, and I'm fastened to the belly chain, like so. Now they take another handcuff and they lock me to the wheelchair. As I was being pushed into the front entrance, I can see a lady on a payphone. And this lady was just totally stressed out. So the emergency room was here. So whatever was going on in her life was bad. She was obviously had somebody in the hospital she cared about, and something wasn't right. She was smoking. You can tell she was freaking out. She wasn't looking at us. She did not see this big police presence descend upon the hospital to transport me. So she was totally unaware of what was behind her. To the side of her was a child, 5 or 6 years old. And he is just like watching the whole thing and not saying anything. This lady, as they're pushing me, rolling me in, she's smoking a cigarette, she's on the phone, and she turns around, goes, ah, and screams, drops the phone when she sees me, and grabs her kid, scoops her kid up for dear life. You know how bad I felt? Do you know how bad that made me feel? I swear to God, I felt that freaking small. I wanted to scream, lady, I'm a nonviolent drug offender. They didn't even need to transport me. I'd have drove my goddamn self to the hospital. Excuse my language. But it's true. I didn't have rabbit in my blood. Rabbit means I didn't have it in me to escape. You have to have that in you. If you're ever going to escape, that means you're a life on the run. You're never going to see family, friends, or anything again. That wasn't me. I literally would have drove myself to the hospital and drove myself back to prison. Sounds crazy, but it's true. And at that time, I really had it going on in prison, which is a whole different story. So the lady grabs the kid, and I felt like Hannibal Lecter. It was just a freaking horrible experience. They brought me upstairs. They wheeled me in, and the nurses were all really great. The nurses were actually pretty cool. They hooked me up, got the anesthesiologist in, and they started getting me loaded before I even went to surgery. They were getting me high in the little the holding area room. And I was wheeled into surgery, and I spent an hour and 45 minutes in surgery. I didn't know this till later, but this is what happened. When the doctor was done, I was still in the ER, in the operating room, OR, I'm sorry. And I woke up. And when I woke up, I said, I was in pain. And I said, I gotta piss. And one of the officers, whose name was Bubba, big country boy, and they called him Bubba, leaned over and said, you got a catheter in you, Bubba. You got a catheter in you. I said, huh? And I said, what's going on? I said, I got to piss. He said, you got a catheter in you. I said, I heard. I said, why do I hurt so bad? He said, they cut your dick open. I immediately went into shock. And they threw blankets over me. And I cussed several times. And the doctor, don't cuss. There's women in here. Don't cuss. And I was cussing. I don't know why I was cussing. I was in pain. I was in a lot of pain. What had happened is they have to stick a lot of stuff in your urethra. So my urethral opening, or pee hole, was too small, and they had to cut it. They then put 2 stitches in it. Okay, so I've got stitches in the most sensitive part of my body with a catheter in it, okay? This looks really good going like this. They bring me back to the room. I stay maybe 30 minutes, and out I go, right back to the prison. Wheel me downstairs. Now I'm drugged up though. I mean, they've got me higher than a kite. Fentanyl for sure, morphine. She gave me Dilaudid before I left, and then they gave me as much drugs as they can give me. But I was in so much pain because of the stitches. Also, you get burning in your urethra. Like even up till today a little bit, I still have some burning from my surgery I just had. So that's common. Some of the what comes with having bladder cancer, which comes with having the surgery. Anyway, 45-minute ride, and it was horrible. I remember I felt every bump, every time I bumped. I don't do good with catheters in me. I do really bad with catheters in me. And again, I've got the stitches in me. When we get to the prison, they come in, again, got the 5-car in front, car in back, gunner behind me, get to the prison, and they park right outside the wall. I had to walk with a catheter in me and stitches sewn in the tip of my penis about the length of a football field. And this is up flights of stairs. It felt like somebody had my prick on the end of a fish hook and was reeling me in. That's the kind of pain, like just snatch me, and I was being pulled back. That's the feeling that I had. I go upstairs and I'm white. They're telling me, you're white. You look like you're right. I'm like, I'm dying. I'm in pain. I go upstairs. There was a doctor named Dr. Salam, who was from Egypt. A very Christian man. He asked what happened. He saw the report. He read the report. Oh, okay. I said, well, I need something for pain. The best thing to pray. You pray. I pray. But he said I needed to pray. That's what he said. I said, I need Percocets. Percocets for sure. I need Percocet. Oh, no narcotics. You pray. It's okay. No problem. No, it was a problem. Well, now I have to walk the length of probably almost 2 football fields, at least a football field and a half, to my cell. And I'm telling you, I mean, I'm getting upset just thinking about how much pain I was in, and that guy told me to pray. I mean, do you know what that does? I mean, you just want to cuss. You want to say every bad thing about religion. I mean, it was infuriating. And so what happens then? I go inside, I lay on the bunk, and here comes friends with heroin. I end up doing heroin just to ease the pain. And that's the truth. I did it to ease the pain. We were running at 26 minutes, and I was going to cut this up, but I'm going to go ahead and finish this. I was going to do this in several parts, but I'm going to go ahead and finish this because I got the catheter in me and the stitches. The following night, next day, I don't get up. I don't get out of bed. They're calling me down to medical because they want to check stuff. I didn't even go. Wouldn't even go because I didn't want to get out of bed. And I did some more heroin. Day 2, I go down there and I want the catheter out of me. I'm sorry. Yeah, the second day I stayed in bed. So the next day I go down there, I want the catheter. They won't take it out of me, okay? So that night I laid down, and for whatever reason, God only knows why, I start having massive erections while I'm sleeping. And these erections got so firm that my stitches busted. So the stitches busted with this catheter still in me. I'm in pain like thinking about it right now. So go down to the infirmary. My stitches have busted. So I got the catheter in me, right? Okay, I want this catheter out. No, you need it. We still got some water. You still got a little bit of blood in your ear. Get it out. I said, get it out now. I was livid. I was out of my mind. Okay, you want it out. She takes the syringe and she pulls 15 cc's. That's to keep the catheter in. They have to inject water, which keeps it up. Once she did the cc's, it's what it says, 15 cc's of water. She pulls it out. She goes, okay, are you ready? Are you ready? And she pulls. And when she pulls, her eyes lit up. And I can see, and I'm feeling like, and I freak out. One of the nurses, whoever put the catheter in me at the hospital, put 30 cc's of water in me. So out of my penis comes a freaking balloon like that big. I mean, it was just, I mean, you couldn't make, excuse me, I'm all in for cut. You couldn't make this shit up if you tried. It was insane. I was freaking over the edge. I was over the edge, man. And yeah, so that's what happened. That was my experience of my first experience of being diagnosed with bladder cancer, how it all went about, and my first procedure. And there's plenty more after that. I don't know what I'm going to do yet, but yeah. So I've taken up a half hour of your time. I hope you enjoyed. I hope my misery made you happy. But everything I said to you is exactly how it happened. It was insanity. So if you're going to the Federal Bureau of Prisons, try not to get sick. Hopefully don't come down with cancer. Have a good day, you guys. Will be a new video tomorrow.